So today we have Dr. Priyanka Mehta with us. Thank you, doctor. Thank you for joining us today.
Thank you, Nidhi. Thank you for the invitation. Thank you for inviting me to your podcast. I'm really looking forward to the conversation.
Amazing. I'm super excited as well. So Dr. Priyanka Mehta, she is OBGYN and a member of Royal College London since 2013. She is recognized as an integrative gynecologist, hormone specialist, and surgeon passionate about women's health. Her mission is to ensure comprehensive care for each woman, focusing on physical, mental, and emotional well-being. These days she is practicing based out she is practicing in Dubai, and she is a co-founder on One Life Wellness Consultancy, Vihad Health, which is rooted in the belief that we have two lives, and the second one begins when you realize that you have only one. She has more than 20 years of experience in hormonal care for conditions like PCOD, PMS, perimenopause, menopause, and well aging. She has received many recognized certificates and have performed more than 3,000 advanced surgeries and assisted birth for more than 3,500 babies. That is a lot of babies.
Yeah, that's with 20 years of experience and maybe even more. I mean, we really stop keeping count after some time.
um,
But now, as I am myself aging, now my focus is more towards hormone balancing, menopause, and perimenopause.
Amazing. This is so exciting that you are focused in this space, and as there is a lot of lack of awareness is there, not enough solution out there. So thank you for focusing on this area, and this whole podcast we will be discussing about hormonal health post 35 years, perimenopause and menopause. So let me start with the first question. So, as women, we do experience low energy, mood swings throughout our menstrual cycle, right? And for us, no 2 days are same. Every day is different with respect to our cycle. So, in this scenario, how we can identify that perimenopause has already started, or is there a clear marker for that?
So I will just, start from a little before that. As women, we have two ovaries and we are born with a fixed number of eggs. So if you look at the number, at birth, we have 2 million eggs. By the time we start our puberty, that means we start our periods, it comes down to about 400,000 or 4 lakh eggs. Now, this number will keep going down. So, by the time you're maybe 48 or 50, you are just left with less than 1,000 eggs. So, our hormones will keep fluctuating throughout the cycle because the two most important hormones are estrogen or estradiol, which is made in the first 15 days. We also call it the follicular phase. That's the time estrogen is a hormone which is like a fiery, flashy sister. You feel strong, you feel very confident, right? In the follicular phase, that means just after your period, you're very excited, you're not moody, you think you can conquer the world. In the next 15 days, after day 50 to day 30, progesterone is the calmer sister. That's the one. Usually, that's because nature is preparing the womb, the uterus, and preparing us for pregnancy. Pregnancy is not happening. Both the hormones they crash just before the period, and that's when you feel moody. Now, menopause is a time when, after the age of maybe 40 or 45 or even 50, you totally have no hormones, your ovaries are running out of eggs, and there is no more hormone being produced. Perimenopause is a transition phase which can last for 8 to 10 years before that. So, from maybe your mid 30s, early 40s, you can start feeling mood swings means that the same as your ovaries are having less eggs, the brain hormones called FSH, LH, they are going to tell your ovaries make more hormone. So in the same day, you could have a lot of hormone being released, and then suddenly there is no hormone. And that is what, the fluctuation. It's like you're having PMS every day, every other day.
Right.
That is what happens in perimenopause.
Right. So I understand first it's a very long span, right? So it's a long span of 8 to 10 years. And as you said that even in one day there will be spike of hormones, or in the morning you are feeling low and then there is a sudden spike. So what I understand, there is no clear marker where you say like, hey, this is perimenopause, or because how I am just thinking that when you are young there is some level of LH or another hormones. So is there, when we say like blood glucose and we say hemoglobin, everyone is aware these days. You ask about hemoglobin, everyone will say like out of 15 I lie there. So is there anything with respect to hormones which we can say like, okay, you are this much low?
So there is no blood test which can diagnose perimenopause. So often women, when they're not feeling like themselves, I tell women that's the most, and that's even in there's a journal article also which is saying not feeling like yourself. So that is one symptom when you have been energetic in your you're building your career, you're getting married, you're having children, relationships, and suddenly you feel something is out of sync,
Right.
right? So that could be the beginning of perimenopause. If you want to look at the numbers, usually we do measure the hormones for women when they come to us. So we measure estradiol, which is E2. So we have three types of estrogen: E1, E2, and E3. We will talk about that later. But E2 is the most important, or estradiol is the most important hormone. And we measure the estrogen or the estradiol in the first 5 days of the cycle. So usually the levels will go somewhere from 50 to even up to 300 and 400 picograms per ml. So this is just a rough indicator,
Right.
right? This is not to diagnose the perimenopause. But if the hormones are really low throughout the cycle, then we could think that, okay, maybe you're running out of hormones. Then we measure the progesterone. Progesterone is a hormone which is released in the second half of the cycle. So that one we measure on day 20. So on day 20, the value should go from around 4 to 30 nanogram per ml. So that is approximate. We just get an indicator, like women who have come for fertility or for IVF, we want to test their progesterone on day 20. That is it appropriate, or do we need to give them more progesterone? So FSH, LH are the hormones made by the brain. If the level of FSH is more than 40 milliliter unit per liter for two times when we have tested, then that indicates that you could be in, menopause. But perimenopause, there is no single test which will tell us that you are in perimenopause.
Right, right. So what I understand, the real test is how you are feeling. So if you are feeling
Absolutely.
that, okay, there's something wrong, I have never experienced this before, I am being into this cycles, we are having this menstrual cycle for years now, but this is something which is very unusual. People are, at times people around you can also identify that there is something going with you. So I think that is a clear indicator. And then there are some tests which can be done, but still for perimenopause, the clear markers are not there which can exactly tell. So thank you, Dr. Priyanka, for sharing this. So the next question is about, because you are interacting with a lot of women out there, and I'm sure a lot of women are coming with their, most, painful experiences with you. So is there a vivid memory of a client coming to you, experience something which you were like, oh my god, this woman is going through perimenopause and it is shattering her life in many ways? My whole aim of asking this question is, most of the time I interact with a lot of women myself, they have this thing of like, okay, it will be a phase, it will be pass, okay, we don't have to do much about it. So my whole aim is to ask like, is there that kind of vivid memory in your mind?
Yeah. So if you look at the symptoms of, see, menopause is very clear. No period. Okay, people think that now I'm in menopause. Most of the women are able to diagnose, but there are more than 80 symptoms, and we are just thinking of menopause and these hormones as only for our periods and fertility.
Right.
But hormones are very important. They have more than 300, 400 functions in our body. If you see, every organ of our body has the hormone receptors. So starting from brain symptoms like brain fog, it can just happen that you don't remember where you kept your keys. You're talking to someone and you suddenly forget their name also, or what you're talking about. So all these things, brain fog, memory lapses, feeling tired, fatigued. So I had a client, she was 43, and in fact she had one kid who's 9 years, and then she was trying for another baby. She has gone through multiple IVF cycles also. But the most important test, which I think for women, is called AMH, anti-Mullerian hormone. That's a test for your egg count. And somehow, in the process of IVF and the treatment, it was done, like 3, 4 years back, and then it was never done again. So when she came to me, weight gain, belly fat, that is really a very common symptom which most women, they are eating the same food, doing a lot of cardio exercise as they are doing, treadmill, hit trainings, hit sessions, very high intensity workouts, and feeling very tired and fatigued, right? They are not able to wake up in the morning. And this lady was, you could feel her anxiety and her whole thing, that what is happening to me. And then she just broke down. She started crying that I have been eating well, I am eating all the right things, my tongue is becoming, green color, I'm having bloating, belly fat, I'm gaining weight. And then when I tested her AMH, which showed that it is really low, so that is again an important test which can tell you that your egg count is becoming less.
Right.
Hormones were all over the place. She also had insulin resistance. She had thyroid antibodies. So no, this was never tested before. And then when we started her on our program, in which I offer them science-based supplements, you need to understand, whether you're taking omega-3, magnesium. There are so many supplements, and people are taking, like there are supplements like ashwagandha. People are just taking it, and her cortisol was really low. So it was, kind of adrenal fatigue and everything happening together. And once we were able to, find out what's happening, give her a holistic plan for her care, in 3 months time she not only lost it, 3 to 6 months, so only by 6 months, she wanted to try the injections for weight loss. I said, let us try another 3 months, give us 6 months. And by that time, so in 3 months, she started seeing the difference in her appetite, her bloating. And then once, with even I use bioidentical hormones, and I, advise them lifestyle. So my session of consultation goes for at least 45 to 60 minutes. And after that, again, we have a detailed session. So in 6 months' time, she has lost around 8 to 10 kgs, and she's feeling stronger, feeling energetic. And now, she's even thinking, okay, I can go back now, think about IVF. And that was, a real success story for me, that, okay, you're really feeling so lost. You think that everything is over. You don't know what's going wrong with you. And then when you see the numbers of the blood test, when you see the symptom questionnaire, you try to figure out that I'm not going mad, I'm not going crazy. There is really something which is missing. And then when you really pinpoint to them, it makes all the difference.
Totally. I can totally relate to it, because most of the time women are like, what is happening? And no one has, so when we talk about puberty, when we talk about pregnancy, everyone has already prepared you for that, right? Pregnancy, this is going to happen, this is going to happen. When perimenopause is hitting people, people were like, what is this? No one has ever taught me, like my mother, she never discussed about this. So it becomes like, oh my god, I think it is kind of a ghost which you are seeing and you are experiencing and you're going through, but no one around you is there to support. So that is a very important part, that when they identify like what is wrong, they are willing to take those steps. But identifying that is super important. And as you said, the one important test can be the reserve of eggs. You can always get it
Yeah.
tested and understand with respect to your, how are you in perimenopause. That will be a good indicator. And as you mentioned, lifestyle modification, supplementation has a bigger role to play. And as of now, I think this whole space has to be, discussed more, and women should be educated much more on this aspect. So thank you, Dr. Priyanka, for sharing this. Do you yourself have your own perimenopausal story where you were like, oh my god, I'm not feeling myself? Do you have that story?
So I had surgery for endometriosis, for which one ovary was removed 10 years back. And I was on and off some kind of hormonal medication so that it doesn't come back again. Usually with
Right.
endometriosis, we give either progesterone or we give the combination pill. But sometime in the middle of 2020, when I was 44, all of us went through all kind of upheaval during COVID times, I think so,
Right,
right?
totally.
And I was not getting the period, getting it, so it was a bit erratic. So I thought, okay, let me just stop everything and see. And when I did my test, my FSH was already 95. So I don't even know when I went through perimenopause. Maybe because I was on the oral pills, the estrogen, progesterone, so that I don't get endometriosis. So as a side effect of that, some kind of hormone replacement was happening.
Right,
And then I decided, okay, I'm anyway fit. I'm doing a lot of exercise. I used to do a lot of Zumba, and you're dancing, you're walking 10,000 steps, and you're having an active lifestyle. You're taking care of your food. So that's what the journey was. But in 2 years into and I went into a early menopause. So menopause, less than the age of 45 is early,
right,
less than the age of 40 is premature.
right, right,
Usually the age of menopause should be 51 to 52.
right,
So almost, if you are going into an early menopause, you're almost 8 years without the hormones which you're supposed to have. I should have been advised and I should have taken hormones, But I thought, like every Indian South Asian woman is thinking, my mother never took hormones, my grandmother never took hormones. Hormones are unsafe. Hormones are only taken, it's a Western problem. I can
Right.
take care. I will do this. And life was going on. But you start feeling that fatigue and tiredness, and you start that you're not able to work as much as you can. And that's when I myself met a healthcare provider who understood what I needed,
Right.
and that's how my now I can feel, because I am using bioidentical hormones. I can feel the difference. I can feel the energy. I can feel my whole body, kind of change and transform. And I also, of course, hormones are not magic bullet.
Right.
I really looked up a lot of lifestyle change, which means weight training and strength training.
Amazing.
And
Amazing.
it was a slow process, because sometimes you're so busy, and then you had a trainer, you do that for some time, then you start doing, and then you progressively start feeling stronger as you start building muscle, and you're able to go progressive with the weights. And I really wish someone had told me in my 20s and 30s. So what I have decided is, then I now tell my daughters, and I take them also with me, so that you can at least inculcate these good habits, and start with them. And also all young women who come to me, I talk to them about. So I also see a lot of young girls with PCOS starting from the age of 13 and 14. So you slowly bring it to them, that think about weight training, think about exercising in this way, and that has really helped me. And I really wish that, for my patients also, I don't call them patients, they are women who are going through this phase of life. So I
Right.
just tell them, let's well age together. We are
Amazing.
all going to get old. We're not getting younger, but it has to be well aging. And that is my mantra for everyone.
Amazing. Thank you for sharing. But this is such a nice thought that aging is natural process, but let's do it together. Let's do it in a strong way. And the kind of emphasis you are putting on weight training, which is amazing, because most of the people still have this thought, if they will lift weight, oh my god, something will happen. People will tell me, yeah, Nidhi, I want to get stronger, but I don't want to be bulky, I don't want to get those muscles. I
Yeah.
like, forget, you're not going to get it. You really need to work very hard to reach there. It is like you are here for driving a car and you are like, यार मैं गलती से ना वो
Formula.
फॉर्मूला वन ना चलाने लगूं. It is not going to happen. So thank you for sharing your own story, because at times, and I can understand, endometriosis, you must have gone through a lot of hormonal issues during your even early 30s, and just understanding and learning more about
No,
endometriosis.
even that was actually, I had nothing at all. It was just one fine day I have fever,
Mm.
and when I do the ultrasound, I have a cyst. So I was totally asymptomatic. So
Okay.
it was just an endometriosis confined to the ovary, and then I had because it was so big, so it was better to. And I never thought, at that time. So even healthcare providers, gynecologists, we are never taught about menopause. Maybe we have 5 to 6 hours of training, and I remember we have a book called Novak, where there is a gynecology and there is a chapter menopause, and most of us don't even read it that seriously, because we are more focused on pregnancy,
Right.
IVF, training, surgery, and we need that. Of course, we need training in that. But menopause and perimenopause is an area which, perimenopause is a word itself. If you ask me, I don't think many of the gynae trainees or practicing gynecologists will be able to clearly pinpoint it. So I'm
Right.
very happy that menopause is becoming a buzzword now, and everyone is kind of talking about it, so that more doctors also need to learn and be able to help.
Right.
Because I was reading somewhere more than 1 billion women are going to be in menopause in a year. I mean,
Yes,
look at
totally.
the numbers.
Yes, and what we need to understand first, the number is very big. Women are 51%. So we are not, a small number. We are almost 51% of the total population. The other thing is, I come from a background where I was, working in corporate. So when you are around 40, you are at like mid management level. So what will
True.
happen during this time? There's a lot of pressure on women to, take next step, to take more responsibility. And then at the same time you start going through this perimenopause. So there are studies that out of 5, one woman is quitting her job in UK and US just because of perimenopause, because it is too hard for them to take. And I'm sure there are not many statistics available for India, but I'm sure the scenario is even not better in any scenario, in any case, might be worst, I'm not sure, but these are the statistics. So let's deep more into perimenopause. There are a few symptoms which you have already highlighted, like weight gain is a symptom. Some kind of mood swings will be coming in. You will not feel as you know, yourself. But are there some symptoms which are commonly overlooked by women?
Yeah, so there are more than 80. We call it like a laundry list of symptoms. So when you start from the brain, it's brain fog. Brain fog, people should not think is dementia. You're not going crazy. Another patient I really remember, she had early menopause. She's around 42, and she's like, I think I'm going cuckoo. I said, first, stop telling yourself that, because it's very important that you do a lot of positive self talk. And as women, traditionally we are just, always, you want to keep your family first. You, even when women working, I have done that. You work for 12 hours, you come back, you don't even, you just want to immediately go to the kitchen, make sure the children have had their food, homework. So a lot of things can happen at this time. So brain fog, mood swings, memory lapses are important in terms of the head. Migraines can worsen. Some women even complain of tinnitus. These are some unusual symptoms where there's ringing in the ears. So that can be with B12 deficiency, at the same time be a part of your perimenopausal symptoms, because hormones are now, becoming less. Dry skin, then dry eyes. Sometimes it just eyes keep watering. The skin can suddenly become very dry, very itchy. Then some women even have told me that, they have this bad odor. They feel that, they're applying a lot of perfume and they are scrubbing their underarms and doing all kind of treatments, but there is a menopausal odor. So your body will change. Then the gut bacteria changes, so you can have bloating, you're not able to digest food, you cannot eat that much as you are able to. Belly fat, of course. So visceral fat, which is a fat between our organs, from 5% goes to almost 20%. And that is why the inches are going to go up, and your pants are not fitting you anymore, and you're just thinking, what just happened there to me, right? If you're working in a busy corporate job, you have these smart pants which you have got. And in fact, I was listening to one Mel Robbins podcast where she said that she only has nowadays pants which can stretch, right? Because you really don't know what's happening with your food. And of course, aches and pains and joint pains. And with the periods, you can have either early period or late period or intermittent bleeding and all kind of things because of the fluctuation. Sleep is a major issue. A lot of women find it difficult to go to sleep because the first hormone which starts to come down is progesterone. And progesterone is a calming hormone, it helps you sleep. So they either find it hard to fall asleep or they wake up at 3 a.m. So
Right.
it's like, you're in love again. So you are up at 3 o'clock, not able to sleep. The most common symptom which people think of menopause is hot flashes and night sweats. So again, in perimenopause, also you have women who just wake up. Many women realize only with this symptom that they just wake up, and you know that's what you're either pulling the blanket to you or you're pushing it away. And even a lot of relationship issues can happen that way, because your partner wants a cooler room and you want a more cool room, and all these things can happen. So that is again not a problem of the skin, but it's a problem of
Yeah.
temperature control. Because estrogen or estradiol controls our center for the temperature, the center for memory, learning. So that is what is happening in this time of perimenopause.
Right.
And
Right.
of course, fatigue, tiredness, testosterone levels are going down, so you're not able to work as well as you can. You're not able to multitask. Lack of libido, lack of interest in sex, all these things. And if you look at very specific symptoms, dry vagina, or this frequent infections, because again the flora and the bacteria in your genital tract are also changing.
Totally, totally. There are a lot of symptoms, and I'm sure at times what will happen, women will go to very specific doctor. So one of my client was
Yeah,
going through a lot of itching while passing urine, and I said like this is perimenopause, and she was going to a doctor, and the doctor is like, no, no, this antibiotic, that antibiotic, and the whole focus was not
totally.
on. Yeah, so these are the issues for me. I'm 42. I'm almost touching 42, and sleep. Oh my god. I realized this is not me. I'm unable to sleep for like 3 days, and I was like, "Oh my god, this cannot happen. There's something wrong with me." And then I became much more religious with respect to my night routine. I'm sleeping on time. I am having that 1 hour before my sleep, but that was my moment that this is perimenopause. This is not you. you have to focus, you have to bring focus on your health. You have taken your body for granted for long. So like much more get much more relief. Move to the next question, and this is very different. So a lot of women also experience a lot of bleeding, so their periods are much longer, and at times they also see the duration is going less, but it is like different for different people. So I know that when the periods are too long, too much bleeding, women experience I think their iron levels are going down, lack of energy, because it is impacting your whole body. What they can do during this time?
So, again, I always go back to what's normal. Normal menstrual cycle between 24 to 34 days. So, either your periods come on first and they come back on 24th or 25th again, or they come by 35, right? But if it is either getting delayed, means it's becoming less frequent, you're having your periods once in 2 or 3 months, or it's coming once every 15 days, or you have intermittent unscheduled bleeding, so you bleed and then you have stop bleeding, stops, and then you bleed again. Or you could have bleeding which is continuing for longer than 5 to 6 days, right? Or if you are changing more than maybe 3 or 4 or 5 pads which you've been using, or your menstrual cup is filling up more, you're using more tampons. So anything which is now off the ordinary, or it's becoming less scanty. So both ways, any changes or the pain is becoming severe. So like I told you, the hormones are getting less and less. So we need estrogen and progesterone both. They're like sisters, they need to balance. So as progesterone is a hormone which is becoming less as you are going from perimenopause to menopause, in the absence of progesterone, the lining of the womb, that is called the endometrium. So this lining starts growing more and more and more like wild grass. So estrogen dominance is what happens. There is more estrogen, less progesterone, and that is why you can have either irregular bleeding, or the lining becomes so thick there is no progesterone, so it will not shed, and then after 2 months you have heavy bleeding. And most women ignore the heavy bleeding. Most women think that because their mothers have said and their friends have said and their friends group has said that this is normal, don't go to a doctor, they will do a lot of tests and something will come up with it. So I have seen women waiting for even 3 months, 6 months sometimes, till they become really anemic, hemoglobin comes down. So we are young women, even your hemoglobin which is normal 12 drops to 8. Till that time they will have no symptom, and suddenly they will feel totally lack of energy, and you see that it's become 7 and less than that. So then you have to give them blood transfusion and all of that. So the moment you start thinking that you're bleeding more than you used to, or bleeding less, you're having frequent or less frequent cycles or intermittent bleeding, definitely go meet your gynecologist, get a transvaginal scan, because only a transvaginal scan is able to pick up the lining of the uterus, or if there is any problem in the ovaries, because September in fact is ovarian cancer awareness month,
Right.
and the ovaries are silent, they whisper. So we really, really don't know. I myself had a cyst in the ovary. Being a doctor, gynecologist, I didn't know till it became 10 centimeter, because it will just keep growing.
Right.
So after the age of 35, I think we owe it to ourselves. Every 6 months or every year, get a scan, get a gynae checkup, get a pap smear, so that you are just keeping track. And if there is any issue,
Mm.
it can be resolved. Thyroid test is important. I ask all ladies to do the thyroid antibodies and the TSH, so that you know that this is in the normal range. If that is abnormal, that could cause the irregular bleeding.
Right.
We check hemoglobin. We should also check ferritin. That is an important test, because if your ferritin is low, again, you may feel very tired. So hemoglobin may be normal, but ferritin is low. So optimum ferritin, vitamin D, vitamin B12. These are the very important tests which can affect your periods, and it can. Plus, there could be problems like I said, ovarian tumors, ovarian cysts, some swelling, or there is something called fibroid swelling in the uterus. So all this can be picked up.
Right. So I'll summarize, and I'll as soon as you'll see irregular periods, too less,
Yes.
more. We have already discussed the what is less, what is more. Please go and visit your gynec. Please get a scan done. Please get all the deficiencies with respect to iron, ferritin, thyroid done. Today I think we are in a privileged era where tests are very affordable. It's very easy. They will come at your home, they will take it. So please, you are already spending on your makeup and other things, please spend on this as well please prioritize your health and go for regular, at least if not 6 months, in a year you need to go for a gynec test with a scan,
Absolutely.
with the HPV spam, what we call that
Yeah, the
test.
HPV test and the pap smear test. And again, breast, I tell all women, as long as we are alive, we have
Right,
breasts, we have ovaries and uterus. Just make sure once a year someone sees them, checks them, either
right,
do ultrasound or do mammogram. There is thermography. There are different ways. Just think about it. Always thinking. And October is again going to be the breast cancer awareness month. So
right.
getting all these tests done is going to really help. If there is a problem, we can pick it up early.
Right, right. Very, very important. We are in an era, I say, like, we are in an era where all these tests are super affordable. We should not get into a place where at a later age, at a later stage, we are finding out all these things. So thank you, Dr. Priyanka, for, creating this awareness and summarizing this. Let's come to the preventive side. So we have discussed enough about hormone. We have discussed about perimenopause, how all these things are going to impact. What are the important strategies which women can follow, like in their 30s, when they are around 35, but they don't want to have kids anymore, like that age? What are the important strategies they can ensure so that they have a smooth transition in perimenopause? When they hit menopause, they are still in a good shape.
Like, hormones are like a Beethoven's symphony. It will go, it's like an orchestra. So only when things are out of sync, that is when you start realizing that what's going on, or that's when you go into disease, and then you rush with a symptom. I mean, as early as the age of 25 or 30, you can start thinking. Like I told you, there is a test called AMH. It is anti-Mullerian hormone. I advise even younger girls who come with irregular periods, as early as 20 or 25, we get these tests done so that it gives a rough idea about your egg reserve. And if you are thinking, okay, I want to be focusing on my career, you want to plan your family later, then you can think of the options of egg freezing. Again, that is something, social egg freezing has become common nowadays. So you can at least have a conversation with your doctor about that. Preserving your adrenals. So adrenal glands are small glands which are on top of your kidneys. They will release the stress hormone. The most common cause for irregular periods in women who are doing very stressful jobs, or even for students in university, girls in their 20s and 30s, is lack of sleep. So, doom scrolling, staying awake after 12, being awake till 3 a.m., that is the time when your body is making cortisol to be used for the next day. The adrenal gland, the tiny little glands, are making cortisol, which is an essential hormone for you to wake up in the morning
Right,
and to do your things. But if you are awake, cortisol is essential for life. So, progesterone, the hormone made by the ovary, will get converted to cortisol. This is called the cortisol steal.
right,
And that is when no progesterone, because periods are not essential for life. So, you will stop getting the periods, you will have irregular periods. And most common cause is that. And then without progesterone, your cortisol is going up and down. So, that can cause the weight gain.
right, right,
So, like I say, for all ages, start thinking about. So, that is about sleep, right? So, try to sleep. I tell the girls, try to be Cinderella now, because in your 20s, I think all of us have been like, I mean, I was not a saint. In
right,
our 20s, we want to sleep late, we want to have a lot of fun. But the moment you move into your 30s,
right,
there has to be, I tell women now, adulting is important. You have to become adults now.
right,
Start having a tab on your, because especially for Indian girls and women, I think once they're in their 30s and 35 and all, then the pressure of the marriage and family, and even if you've been focused on your career, some point of time you think. So you plan so many things. Plan this part of life also. Like
right,
if you want to have a baby, you want to have your pregnancy, either do your AMH, think of egg preservation if you don't want to have a pregnancy early on, if you don't have a partner. If you have a partner, then you have embryo freezing. So a lot of options are there nowadays. Explore all of those. As I see a lot of women who are coming at 38, 40, very low egg reserves, and then they are trying a lot of experimental things of stem cell in the ovary, PRP in the ovary, and you don't get the good result. I have, we had the example of Priyanka Chopra, I think so. So
right,
if you are keen that you want to have a family at some time, but now you're focused on your career, go ahead, do that. Think about egg freezing, think about preserving your eggs, think about stress. Again, I say sleep, sugar, and salt, sugar, sleep, and stress.
right,
So
right.
salt and
Amazing.
sugar, enjoy your treat. but try to move things towards dark chocolate and things like that. Check the labels. I always read the labels, because you will have so much people will say this is healthy. Anything that is shouting and saying I'm healthy is maybe not healthy.
Right,
So
right,
read the labels, be wise what you're consuming, and respecting your body is very important, I think, at least as you move into your 30s, because otherwise when you knock on
right.
it'll be hard.
It will be hard. Thank you for sharing this. I think this 4S is very nice and easy to remember. Salt,
Yeah.
sugar, sleep, and
Sleep and stress is again
stress.
mindfulness, right?
Right.
So as we wake up in the morning, I do that myself on certain days, right? You have your phone and you just start checking your WhatsApp. And I think when you wake up, that 10 minutes or 5 minutes is the time your brain is getting ready for the day.
Right.
So doing little bit of square breathing, deep breathing can help you as just start. So
Right.
I talk a lot about this vagal nerve stimulation and all to my patients who come. So then they get a good session. Okay, do this deep breathing. This is the vagus nerve. Start breathing deeply, and all these things, they work together.
Right, right. And I'm so glad. I think you are that new age of doctors who are there and who are not thinking about medicine. Probably this is my perception about old doctors. They give a medicine, or if there is no medicine, they are like, "You're okay, just go." So, but you are
Yeah.
the way you are, discussing about, a comprehensive health with respect to emotion, with respect to sleep quality, lifestyle modification. I think that is a new age of doctors, new age of medical healthcare, which is amazing. So thank you, Priyanka, for sharing this. Understand that women are not moving enough, and we are in an age where a lot of us are sedentary. We are not having the required amount of mobility. How important it is for women above 40 to do strength training, and what kind of a strength training do you suggest for women in this age?
So, like I told you, when I was 40, I myself had no idea about weights, even though I was going to a gym and I started, but it was like not a very, what do you say, I wasn't very happy.
Mm,
I joined the gym, I had a good trainer, and it was like very mundane for me. Like, I was like, okay, when will it just get over?
right, right,
But now, when I have flipped over to post 45, and then when you see the belly fat, and you suddenly, because I have always maintained weight. So, when I suddenly gained around 8 kgs and I'm not eating too much, I thought, okay, I have to take things in charge. I mean, these are steps. So, for me, movement is important. As you see now, I always have a tracker to my steps.
right,
I try to, so when I park my car in basement two, I try to walk up to first floor. So that is almost three floors there.
right,
And of course, for coming down, I prefer the lift. So my climbing up is as far as I can. These are called neat, non-exercise activities where during the day you can plan things. I try to park my car as further away from the door of the hospital so that I can walk. So that is again adding my steps. And of course, 3 times a week, I try to go to the gym where it is 10 minutes of the treadmill where I incline. So that's
right.
important, the incline, and then I try to maybe run faster, but it's not a
Mm,
very fast paced run. But strength training in terms of lifting weights, whereby it's improving. See, at least I just got grocery. So when I get grocery, these boys are thinking, okay, will she be able to carry? I'm like, no, give me even in one, I can carry it. So
totally.
being able to lift your water can, being able to lift at least 6 kgs to 8 kgs grocery,
Right.
taking things. So I think that is important for mobility for women, because we are living longer,
We are living longer.
right? So if we are living longer, we need to, the at least one third of our life, the last decade, the last 3 years, 30 years of our life is important. And for me, when we talk about women's health, we are only thinking of reproduction, we are thinking of periods. But health of women, where I tell all the ladies, brain health, muscle, your bone, and your heart health, I think that is really, really important. And if you talk of, movement and muscle, I learned a term called sarcopenia, whereby you're losing muscle as you're aging.
Yes.
So it's so important that building muscle, even as you go into your 50s and 60s, and then you stay stronger. And I think there are so many resources like your page, I was seeing, there are so many ways you can inculcate that whole training. Even when you're on your holiday, you can, not totally forget everything, but keep it an active holiday, and then teach it to your children also. As a family, when you do it together, I think it becomes very easy for
Right.
women too.
Totally, totally. Thank you for shedding light, because when it comes from doctors, now people will take it seriously. When we fitness people talk about it, they were like, "It is good to have, not necessary." But when doctor is saying, people are like, "Yeah, this is I need to do this."
Now I tell people, don't check the weighing machine. Of
Right,
course, I have a weighing machine here. I will check it every day,
right.
but don't lose weight. I just tell them,
Mm,
please don't lose weight. And then they are like, what do you mean? I'm like, please gain muscle.
right,
And that's when people realize, okay, go to the gym, at least do a body fat analysis. When I do it, I see, okay, this was my muscle last year. Now it's building up, and you feel good about yourself.
totally,
So,
totally.
that's so important.
Yes, this is very, very important. What we need to understand, as women, we are born with lesser muscle mass, higher fat percentage. So we are already at disadvantage. So what will happen? Your male counterpart, your husband, or people, all the men around you will be much more fitter, even with higher weight, even with higher age, right? But women, as after 40, them you see a sudden decline in
And with menopause, all the more, no, you suddenly become old because these hormones have been protecting you all the time. So women are more. In fact, today's World Alzheimer's Day, so women are two times as likely to develop Alzheimer's and dementia.
right, right,
So only when we, keep thinking, okay, how do I add protein to my diet? Almonds, omega 3, all of these things are so essential. So building muscle, and for men, it's easy because every day morning they wake up, they get testosterone, they're ready to
yes,
go
yeah,
till the end. That the levels may come down a bit, but it's not as drastic.
right,
Whereas for women, and it's not that we are retiring at 50 or 55. I think most of us are starting our second careers or starting something new
actually,
at 45 and 50.
totally.
So if we really want to be in the game, fitness is non-negotiable.
Totally, totally. And I always tell them, this is the time, catch it. Your youthness, your hormones are still there. When you will hit 50, then it is possible, but it is harder. Why don't you
Harder,
do it right
yes.
now? It is so, so good. Like, do it now. And the other thing, especially with women, we see diastasis recti, we see pelvic floor
Yeah.
dysfunction, pelvic floor prolapse. So these are like so complicated, and I'm sure there is no right answer. They will put a mash, they will try to do something, but it is complicated, and it is going to impact your life post
Again,
menopause.
women in that, I have a patient, she is just 30 and she's not even obese. And she just said she started having incontinence. She has no children, nothing. She just came for PCOS and she's saying, I have incontinence. So I had to bring her back, again, talk to her for 30 minutes, explain to her about the Kegels exercises, pelvic floor exercise, and bridge pose. Sometimes I just explain to them that just do a bridge and do a squat. So those muscles will get tightened. And then like when she comes back a month later, and of course she was not drinking enough water, so urine infection was also there. And then you don't expect a 30-year-old to have an incontinence. There is no other pelvic floor weakness.
Right,
But that's then when she thinks, okay, she's taking a lot of sugar. So everything then makes sense to her. And then when she's relieved of the symptoms, then
right,
it's
right.
easy to understand.
So for audience, incontinent is when you are unable to hold your urine. Your bladder is not in your control. You can pass urine anytime, and this is a very embarrassing situation, because if this is happening, you cannot go to parties, you cannot go for hikes, you cannot stay
And
long outside.
exercise.
Exercise you cannot do, because as soon as you start jumping, you will be losing, you cannot control your urine. And all this is because pelvic floor muscles between our legs, and if those muscles are super weak, we'll see all these things. So yes, strength training is important. Squats is not just for legs, it is for your pelvic floor as well. Bridge pose is just not for your thighs or glutes, it is for your pelvic floor as well. So thank you, Dr. Priyanka, for telling this, that even at early age of 30, women are experiencing this, and this all can be avoided by doing strength training. Let us quickly move to the medical intervention. So with respect to test, if we say during 30s, 40s, 50s, what kind of test a woman should go through to ensure that their hormonal health is in check?
So, like I told you, there are some tests that we do on the second or the third day. That is FSH, LH. These are the brain hormones which give a message to the ovaries. And we also check the estrogen, the estradiol in the first half of the cycle. We don't test progesterone because progesterone is made only after day 20. AMH is an important test. If I could do just one test for all women, that is AMH, anti-Mullerian hormone. It is just giving, we are born with fixed number of eggs. So this AMH gives us like a rough test of what is your egg reserve. How much are you having in your, like your
Ovaries.
safety vault, or what is the reserve that you have. So low AMH means maybe you have less eggs, but doesn't talk about the quality. Doesn't mean it is zero eggs. And very high AMH is often even suggestive of polycystic ovaries. So that is a test you can, ask your provider about. Thyroid tests, then I sometimes test for fasting insulin. Again, that is my most favorite test because I have in fact stopped checking sugar levels. Rather than that, I prefer to do the fasting insulin and the insulin resistant test, because again, fasting insulin levels, if they are in range, that means you don't have insulin resistance.
Mm.
Insulin is a hormone which is keeping your sugars under control. For some of us with a family history of diabetes, our cells become resistant to insulin. So the insulin levels are very high. And that can cause all the other problems where you don't get periods, you're getting bulkier, you're gaining weight, belly fat, and all that. And insulin is also going to increase testosterone hormone, which can cause acne and things like that.
Right.
So these are some basic tests which I recommend. And of course, need to check your complete count, your hemoglobin. Ferritin is a test for your iron reserve, how much iron you have in your body. And and of course, vitamin D, vitamin B.
Right. Right.
Most
And
of us, even in sunny countries, have low vitamin D.
right, right.
So
And
vitamin D,
especially in
again, the
India.
optimum level. In India, even here in the Middle East, even though it is, sunny, most of us, we are not going out. We need to go out in the sun for at least 4 hours and expose
Right,
ourselves. But again, we are worried, so we are applying sunscreen, and we don't get enough vitamin D from diet also. So it's a
right,
good idea that, we supplement the vitamin D.
right,
And vitamin B12 again is an important fat soluble vitamin. So vegetarians or vegans will lose out on the vitamin B12. In fact, many people who are non vegetarians also have low vitamin B12 because maybe we are not absorbing it as well.
totally.
So getting these tests done are again essential for women, so that they're it's you're at your peak in your 30s. So let no suboptimal blood value take that away from you.
Right. And as I say again, we are spending a lot on cosmetic because it's very fancy. Take a 1,000 rupees bottle and your skin will be like Korean skin and all that. So please, your health is much more
For
important
me, it
because
is
this is
inside
inside
out.
out, right?
Once your
So
inside is well
please focus
supported,
on
on the
blood work.
outside,
Please
it
get
will
it
get
done
better.
religiously. Visit your doctors, get the test done. It is all very, the cost is very less of preventive care, but the cost of treatment is super high and it is life threatening. So please focus on that. The last thing I wanted to touch upon is hormonal therapy. And as we know, we are taking hormones. So all thyroid pills are basically hormones. Birth control pills are basically hormones. Insulin, when people are reaching insulin resistance, we give them hormones. So why hormone therapy during perimenopause is not widely popular or not being suggested by physicians and gynecologists?
So this is itself a topic of one full day discussion.
I know.
So hormone therapy again is not magic.
Mm.
It's not that you apply some cream, take some tablets, and you don't do the other non-negotiables.
Right,
So again, the first thing is the lifestyle change where you develop good sleep habits. You need to keep your phone down at 10 or 10:30 in order to sleep. If you are doom scrolling, you will find it difficult to sleep.
right,
So good habits, exercise, movement. Now hormones are not new. They have been given from the 1940s. So estrogen for hot flushes has been given forever. I did my residency in gynecology in 2001, and I remember that time in all the journals there used to be pictures of older women taking hormone as a vaginal estrogen cream or oral estrogen. It used to be made from horse's urine. These are synthetic hormones, and they were given oral.
right,
Now the hormones which are available for menopause therapy and perimenopause also, we can give hormones in perimenopause too,
right,
because if you are becoming less in progesterone or testosterone or estrogen, we can replace. These hormones are bioidentical. That means they are identical to the molecule of estradiol, progesterone, testosterone. They are derived from plant based sources, yam, soy. They are more natural, like our hormones. And also, they can either be available in a regular pharmacy as patch, gel, spray, cream, oral capsules, or by a compounding pharmacy.
Right. Right.
But bioidentical, the fear of hormones came from a study in 2002, the WHI study, where they said that there was an increase in the risk of clots and breast cancer. But now they are going back that at that time they were not using a natural progesterone, but the progesterone was a different molecule, synthetic progestin.
Right.
And also cases which were taken that time, those women were 65 and 70 plus.
Right.
There was not a significant increase in the breast cancer. When they use estrogen alone, in fact, there was a reduction in the breast cancer. So the whole study is now being reevaluated and revamped. Current day modern menopause or modern hormones which are available are very safe. They can prevent against, in fact, cognitive decline, dementia, osteoporosis. Most of us, at least one in two women after the age of 50 or 60, is going to develop osteoporosis and a hip fracture, and maybe we will die out of that.
Right.
So these hormones like are very safe. I think I can make a big statement today that hormones are safe. Talk to your doctor, explore what are the options in your area wherever you are. I get a lot of calls from India. I am seeing a few patients also online whereby they are, nobody is listening to them about the hormones, but
Right.
hormone therapy is available. It is safe. There are different options, and depending on your need and your condition, especially you need to, think about them in the first 10 years of your menopause to get the maximum benefit.
Right. Thank you, Dr. Priyanka, for touching upon this. And why I'm asking this, because I interact with a lot of perimenopausal women. There are few women who are like, we work with them, and with the lifestyle intervention, they start picking up and their symptoms improve and they feel good. But then there are some women who are so depressed that it is very hard for them to come out of, like, even from their bed and go out for a walk. And I tried everything. I was like, let's talk to them, let's help them, let's provide them, with respect to whatever they can do, a lot of discussion. And we have our community, we every Sunday discuss things. But I just feel that there is something else to be done, they are not the kind of symptoms they are going through, the kind of mental issues they are facing because of low level of estrogen, which is beyond this preventive space. So thank you for touching upon that, and thank you for working in this space and
I think we will know only after 20 years. I think one generation of women, there's a lot of disservice being done with the WHI trial.
Mhm.
So, fear of, I mean, there is a concept of bikini medicine.
Right.
Women are not just the parts which are covered by the bikini. There is a lot more to our health. So, if there is, I mean, maybe if these hormones were sold as anti-aging medicine, or if they changed the name from sex hormone to something different,
Right.
life saving or something, then people will really
Run
think
for it.
that yes,
Yeah.
we don't think twice about taking a thyroid hormone. We don't think twice about taking an insulin. People are taking statins left, right, and center. I myself noticed that, I have a family history of high cholesterol. So
Right.
I take a low dose statin on alternate days, and that's how, with my, and I make sure I do my treadmill, I do my echo, ECG. I have a family history of breast cancer. I make sure I do my ultrasound breast and mammogram every year. But
Right.
I choose that hormones can be replaced only by hormones. I'm a firm believer on that.
Right.
So that is why, there is there's no right way to it. You don't need hormones, it's not essential. But maybe if it is going to prevent a lot of things in the future and you have the options available, why
Why
not
not?
embrace them? So
Totally.
have a conversation, educate yourself. That's really important. And there are very good resources available out there. A lot of books are there. If you look even social media, there are a lot of doctors who are talking about the modern menopause management. You have books by Dr. Mary Claire Haver, The New Menopause, Lisa Mosconi about menopause brain, Dr. Louis Newson. There are lots of books, lots of
All
resources.
these
I
books
think
to
it's for
me,
you
so
to
I was
advocate for
like,
yourself and
these books are
find
lying
out.
here as well.
Absolutely. Yeah. This is mine.
Right.
That's my Bible, like I read it
Totally.
every day.
Totally. And the work they are doing, and I think when you go through their podcast, you read through the books, then you see like kind of gap which is available. They are raising questions, they don't have all the answers. They are like, there is not enough research in this space. So it comes to that, not enough focus being given to women's health. It is just treated as bikini medicine. But thank you, Dr. Priyanka. So everyone, Dr. Priyanka has her own Instagram. I will be putting the link here. She has her own website. You can also reach out for consultation. She is available. So please feel free to reach out in case you are not getting all your questions answered from your gynecologist. She is there to help you out. And thank you, Dr. Priyanka. The work you are doing, it's amazing. And let's keep this going. Let's create awareness about it, and make this perimenopause time as winning time for women, where they should not be scared about it. They should be like, okay, this is something new which is starting, and I'm empowered enough to sail through this journey with a lot of courage and happiness.
Yeah, no, it's a second adulthood.
Yeah,
If you see in
totally.
Dr. Lisa mentions menostart is second adulthood. Yeah, this is a phase really when you are that up and down of hormones are over. I think post menopause is easier than perimenopause.
Yes.
Perimenopause treatment for us also is sometimes difficult. Patients are like, you gave me this, my hormone. I will say like the hormone levels are not indicative. If you're feeling better, let's give another. After 6 months, they are yes, this is good.
Yeah.
So then they want to get more. So life's great and enjoy each phase of life. Thank you so much, Nidhi. Your page also has a lot of important advice. I really follow you religiously. Thank you so much for the good work that you and your team are doing.
Thank you.
Even related to heart health, I think we forget that women's hearts are as important
Very.
as men's hearts. So
Totally,
let's take
totally.
care of ourselves.
Yes, great. Thank you very much. And yeah, thank you for having us. Thank you for joining us today. And it's our pleasure. Thank you very much.
Thank you. Bye bye.
Bye bye.
That's for your heart.
Yes, heart health.
Take care.